Podcast is now starting. All attendees are in listen-only mode.
All right, good morning to everybody who's entering. We're just going to wait just a few more minutes for more attendees to jump on here, and then we'll get started. Okay, we're just going to wait one more minute for more people to show up. We have 9 out of about the 24 that have registered. So we'll do one more minute and then we'll go ahead and get started. All right, I think I am going to go ahead and get started here. So welcome to Disinfectants, What Clinicians Need to Know to Reduce Risk. I am Jamie Montgomery. I am the office specialist for Oregon Pacific Area Health Education Center. We are also hosted by Samaritan Lebanon Community Hospital. And today we have presenters of Amy Cross and Diana Sims on today's webinar on February 8th, 2022. All right, and I'm going to go over just a couple housekeeping options here. Make sure all microphones are muted. If you'd like to download the slides from the handouts, there is a link for you to do so, circled right there for you. Both slide decks are going to be available to you within 24 hours. They will be posted, or they are available right now, it looks like, actually. If you do have any questions, there is a questions tab specifically for that. And we will be answering any questions at the end of the webinar. The recording will be available of the webinar on www.opahec.org/webinars-1. That'll be posted and available within 24 hours on our website. And if you do have any questions regarding the webinar or getting certificates or CME credits, please reach out to me. My email is listed below, jmontgomery@semhealth.org. This is going to be the activity code. This is really important. The activity code is listed here, 91CAST. To get your certificate to turn into credentialing for CME, you do need to print it from www.eads.com. This activity code is really important. It does expire in 7 days, so please make sure that you get your certificates printed as soon as possible. All right, the presenters and planners of this activity have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. All right, so I'd like to introduce you to our presenters. We have Amy Cross. She's a project manager for the National Pesticide Information Center. Works closely with state, tribal, federal, and other partners to deliver pesticide safety education nationwide. We also have Diana Sims, is the Pesticide Medical Education Director of PERCMed. PERCMed is a cooperative agreement between the US EPA, the University of California, Davis, and Oregon State University. All right, so without further ado, I am going to go ahead and turn the table over to Amy so that she will be able to start our presentation.
All right, so you should be seeing my slides. How does that look, Jamie? Look okay? All right. So thank you for that introduction. I'll be speaking first and then Diana will be joining. And I'm the project coordinator of the National Pesticide Information Center, which I'll be referring to as NPIC just because it's an easier name than our long one. I've been the project coordinator there for about 5 years. I've been with the center for about 8 years. So what I hope to do today is to dispel some of the myths and misinformation that may be quite common from your patients or from others, even within the medical industry. These are really basic things that some of us might think of as common sense. So I'll look at some differences between common products. We'll talk just very briefly about what the heck this list end thing is, if you aren't already familiar. We'll talk about some basic precautions that are useful knowing about all of that misinformation that has been out there. And then I'll touch on some less common topics just very briefly because they have the potential to be much larger exposure scenarios that you could potentially come in contact with or that you might encounter. And then Diana will be talking about healthcare provider reporting requirements, as well as some resources for both providers and patients. So like I said, I'm with the National Pesticide Information Center, and we are an EPA-funded center, so it's actually a cooperative agreement, which means that we're based at Oregon State University, and our goal is to provide unbiased pesticide information. So this is useful for you to know because we are a resource if you have patients that are asking questions about whether different disinfectant products or pesticides for that matter are quote unquote safe. That's kind of what we do. We do risk communication in and around pesticides and disinfectants. So you're welcome to use us as a resource in that way. I'll also talk about how you personally can use us as a resource. So our experts are, although we're science communicators, we're scientists first and foremost. So there might be a variety of reasons why it would be helpful for you to call us. We provide support to providers that may be treating patients. If you have questions about, let's say you're going to be doing some kind of a testing situation to determine any kind of exposure, we may be able to help you find in the literature information about metabolites or things to verify testing information. We might be able to help you look up information about excretion, typical excretion times, or those typical symptoms that someone with an exposure to a particular ingredient might be experiencing. It's very important that I specify here that we don't have any medical training. We also don't have legal or regulatory advice that we provide either, but poison control would be the go-to if a provider was looking for treatment advice. With very few exceptions, the resources that we have and are available to provide are not medical advice. And Diana later will talk about one very popular resource. It's called the Recognition and Management of Pesticide Poisonings. That's one exception where we have access to that document, and it's an EPA document about pesticide poisonings. And so it may provide some treatment advice that we are not providing individually. So another thing that we can offer is patient education materials. These are materials that are typically geared towards the general public. We understand that that requires a variety of messaging types, everything from more technical fact sheets to easily accessible and colorful infographics. All of our materials are written at an 8th grade reading level or lower because we acknowledge that that can be a significant barrier to education is just reading level. So we take really complex topics about pesticides and we distill them down. These may be useful to have on hand, or if you're looking for various patient education materials. So let's talk about some of those common products that there's a lot of misinformation about. I'll talk about 3 similar but very different categories. When a patient, is thinking about using a product, if they're going to the store, if they're wanting to be very fastidious and do their due diligence in order to control some kind of a virus or a germ on surfaces, they may pick up something and not necessarily know what that product is claiming to do. There's 3 different kinds of general products out there. One is just the general cleaners. Okay, these cleaners are identifiable because they say things like whitens, removes grimes or odors. It just says cleans on the label, but it doesn't specify anything about controlling a bacteria or a virus or any other kind of microbe. Now there's a sanitizer, which is a stronger level up. These are products that are specifically tested to ensure that they control the bacteria that they claim to control on the label. So this is the first category of EPA registered pesticide as a disinfectant, or not as a disinfectant, but as an antimicrobial. So there's 2 kinds of antimicrobials. There's sanitizers and then there's disinfectants. And we're really focusing on disinfectants because of COVID. Disinfectants can control either bacteria or viruses, but really they're the only ones that can control viruses. Now that's not to say that soap and water or cleaners aren't also useful, because those can remove germs, including viruses, from surfaces, but the disinfectants are actually controlling them. They're actually breaking down the virus or quote unquote killing it. Now the problem with going to the store and picking up a disinfectant is that a lot of folks don't know that not all disinfectants are the same, and each product may only control a very finite list and can only control them based on the very specific instructions that are given on that label. And so what can happen then is you can have various patients that might use a product that worked for a very specific situation and use it all over. So you can have situations where you have overuse of a product, which can lead to higher exposure potentials. And then you can also have that lead to not actually being effective in their situation and then still having some type of potential negative health outcome from that. So this is another really common misconception, is the similarity between some of the names between those products that are EPA pesticides and those products that are FDA regulated, like hand sanitizers. Now, that word sanitizer is appearing in both a type of antimicrobial and also those FDA regulated antiseptic products. And so the difference here is, where can it be used? No sanitizer or disinfectant, none of the EPA registered types, can be used on people. They are all for surfaces only. And so if it mentions using it on a surface on the label, then it also cannot be used as a hand sanitizer. I think that is something that a lot of people get confused about, especially, let's say we've got a canister of wipes at a school and the students are picking those up and using them on their desk. We'll talk later why students shouldn't be using wipes. But if they're then also cleaning their hands off or using it to wipe their face, that is directly exposing them to a pesticide ingredient, which we'll talk later also about how there can be a lot of eye and skin irritation associated with those kinds of things. So that's the very basic difference between the antimicrobials that are considered pesticides and the hand sanitizers, which are antiseptics regulated by the FDA. So very briefly, I want to touch on this list N. Anytime you go to a CDC website or anywhere else that's talking about controlling for COVID and other viruses, there is typically some kind of a recommendation that if you're dealing with an individual who has become sick and you're trying to clean the premises, that using a disinfectant that's on list N is one of the steps that's provided. So list N is actually it's like 600 products long at this point. It's a list of disinfectants that are expected to control the SARS-CoV-2 or COVID-19 virus on surfaces. Now, the reason that this was so essential in the beginning of 2020 is because none of the product labels listed that they actually could control that specific virus because they hadn't been tested for it at that point. And remember, I said that each of the product labels for disinfectants have a finite list of viruses for which they've been tested and that their efficacy has been shown. And so what this list N has done is it's used a couple of different ways to basically come up with this comprehensive, well, it's not comprehensive, it's growing every day actually, but it's a pretty long list. It's about 600 products long. So this is in order to try to protect human health. There's this list of products that are expected to, for one reason or another, control the COVID-19 virus on surfaces. So I expect that this is something you could very easily search for if you were to just do like a Google search online. But if you have any questions while looking at this list, you can either look through all of the Q&As that EPA has on their website, or you can also call us and we can step you through it. Sometimes I know that patients are asking for products that are lower in toxicity, so we'll talk about that in just a minute. Now on this list N, there are over a dozen, maybe 20 or more different possible active ingredients that are doing the virus control. This is just a smattering. This is just a selection of active ingredients that may be more common. Some of them are the most common, some of them are not. And I just wanted to show you the variety of precautions that are likely going to be showing up on these labels because of some of the potential health impacts. So a lot of the various disinfectant active ingredients on this list and others can be considered asthmagens. Now, asthmagen is typically referring to an environment in which, you know, they're looking at occupational exposures, people who have repeated exposures over time. But if you have, let's say, a home exposure with repeated exposures over time, that can also lead to potential sensitivity, inhalation sensitivity. And so with the quaternary ammonium compounds, this one is probably one of the hardest categories. It is over 200, maybe closer to 300 of the total 600 products. So it's really a popular or common ingredient to see on the label, but you're not always going to see the same name because there are dozens of technical chemical names that fit under this category of quaternary ammonium compounds. So this is just two examples. we might refer to them as ADVAC or DDAC, but when you're looking at the full chemical name, a lot of times that's what's printed on the bottle or on the label of the product. And they are generally referred to as quaternary ammonium compounds, or quats. And so these can have severe skin burns and eye damage. They can also be toxic if swallowed and can be considered asthmagens. Now, there are others like hydrogen peroxide that are lower in toxicity in general, but they can still cause severe eye burns and eye damage, as well as skin damage. I think sodium hypochlorite or bleach is a pretty well-known active ingredient. Peroxyacetic acid or peracetic acid is something that is considered lower in toxicity via the oral route, but it is actually, it's quite harmful still, even though it's considered one of the lower toxicity ingredients. So I'll talk about that on the next slide. Citric acid also, it's going to be considered one of the lower toxicity ingredients, but it still has some pretty severe irritation. What I want you to take away from this slide is not specific ingredients necessarily, but that a lot of them are eye and skin and inhalation irritants, but then also it can matter by which route of exposure someone's exposed for these disinfectants. So this next list, notice how it has peracetic acid on there and citric acid as well. This is a list of quote unquote safer chemicals ingredients list. This is a list EPA created because it has been evaluated and it is considered quote unquote safer than traditional chemical ingredients. We tend not to use those words safer. We tend to talk about it in terms of risk, but just because something is lower in toxicity does not mean that it has no toxicity. Like I talked about before, citric acid can be very harmful to the eyes. Peracetic acid has a lot of other harmful, if inhaled, and other exposure routes. So take this all with a grain of salt, that it depends more about the exposure in some instances with some active ingredients than it does about the ingredient itself. Because I wouldn't necessarily call any of these safe. They're all pesticide ingredients and they're all designed to kill those viruses. So they're all going to be considered lower toxicity, but risk is made up of toxicity and exposure, keeping that in mind. Okay, so some of the precautions, this is a short list that I came up with that we run this hotline to answer these free pesticide questions from the public mostly, or from professionals. And these questions kept coming back and back about disinfectants and wipes. And so I thought that this might be helpful in case your patients are asking some of the same questions. They may see a phrase that says keep out of reach of children on the container, or you may see that. As far as I can tell, there isn't necessarily a unified regulatory definition of this. There might be on a state or city or local level, but in terms of best practices, keep out of reach of children typically means no one under age 18. But that's not necessarily, like I said, regulatory in nature. That's a best practice in terms of pesticide safety education. There's a big difference between these disinfectant wipes and skin wipes or baby wipes. And we have stories from specialists working at our own center where their family members use disinfectant wipes accidentally on skin as a baby wipe. And so kind of knowing that everybody really does have a canister of these just about in their homes, or maybe not, may not realize that they're in a lot of our families' homes or our friends' homes, or also in the workplace and can be, brought in by others from outside. This is also something where, a lot of times they're ending up on the lists that kids have to bring in of school supplies into the classroom. And knowing that they're not for skin and that kids are not necessarily going to know that could potentially lead to several skin exposures over and above what would be expected normally. Some of these can be used for food contact surfaces. It all depends on what's on the label. But where this really is interesting to me is that, again, with the kids having them be brought to school, they may be using them on their desks, which their desks may also become where they're having lunch. Because of COVID, several classrooms or a lot of schools are not using the cafeterias as much. They might be using individual classrooms. And if the desk becomes a food contact surface, essentially, because when you set down a plate of food, especially when you're talking about kids at school, you know, that sandwich might leave that plate, or those chips might leave that plate and land on that surface. And using some of these wipes on that surface, you've now got a disinfectant in those areas. And so that's a potential exposure route that a lot of people really are just not considering. Also, a lot of the products do ask for you to wash your hands after use, even if it doesn't ask on the, say on the label to do that. That's a best practice to rinse those residues off the hands. And then in terms of efficacy, because these wipes dry out as you continue using them, they're not necessarily going to actually be effective like they're designed to do, not actually control the virus. And so what I'm going to talk about is contact time. That is a part of the label that individuals need to follow in order for it to work. And I'll talk about that in just a little bit. I do want to talk about some of the risks of home remedies. You know, when folks see that there are these potential risks for disinfectant ingredients and they become potentially alarmed, they think, oh, well, I can use something that I've gotten in around the home. But one of the riskiest outcomes is that two cleaning products are accidentally mixed that really shouldn't be, and there are a variety of different ingredients that should not be mixed together. I'll call attention to the last one on this list, hydrogen peroxide and vinegar creating peracetic acid, and we already talked about how this peracetic or peroxyacetic acid can have some you know, various potential negative health outcomes from exposures, in addition to some of the very toxic gases that can be created. Also, these, you know, mixing up your own products at home or using things that aren't intended for disinfecting, they really don't have any instructions on how to mix it, and so overuse could be one concern. Also, they don't have any first aid instructions. Typically, they don't provide any guidance for protective clothing, and they're not tested for efficacy, so there might not actually be any control of the virus on surfaces, or not enough to make it worthwhile. Bleach is a big question because it's available, it's affordable. A lot of people already have it in home. There is some mixing and dilution guidance, but there are some precautions as well to look into. If I'm looking at a bleach product that says it's for viruses, it's going to have instructions on there that are different than just a regular bleach product that I'd use for laundry. There really aren't going to be any mixing instructions or dilution instructions. We don't have any of the same precautionary information. It's just not required on that whitening bleach. And it may have additives like sensor gels that change not only the efficacy, but also food safety. So if they were used on surfaces where food was going to be used later, that can increase risks. And then also, because this is something a lot of us have in our homes already, our individual familiarities can lead to less vigilance over time, which can increase exposure scenarios. Now, as providers, you may encounter overly fastidious patients. So there are a couple of points here I wanted to call out that you could be mindful of. One is that masks cannot be disinfected. So disinfection, remember I'm using it as a very specific term. It is using these chemical disinfectants to control the virus. You know, the cleaning chemicals of any kind really should not be used on masks, but there are no products for home use of mask disinfection. It increases risks both to skin exposure and then also to airway exposure. And a second point I'd like to bring up is that disinfectants have no place on food. And there might be some products for food contact surfaces, but they also often require pre-cleaning of the surface to make it effective, and or rinsing with clean potable water after the disinfectant is used. And you can imagine that an overly fastidious patient could potentially be adding a lot more residue onto their surfaces if they're doing this regularly, or if they're doing it onto the surfaces where their food is going to contact, not taking the care to either pre-clean or rinse those areas. And so this might be something that these two situations in particular can increase risk for those that are doing constant cleaning. Okay, so I said I would talk about contact time. Contact time, if there's any part of the label that explains efficacy, it is this contact time. What it means is the amount of time a surface has to stay visibly wet with the disinfectant. So a lot of times, especially with cleaners or just soap and water, you know, we're spraying a surface, wiping it off after and walking away. That's not how disinfectants work. And so what this does is it leaves a residue on the surface sometimes for 30 seconds on purpose, or up to 5 minutes, where the surface is wet with disinfectant to be effective. So let's say that an individual is following this protocol and they are leaving the surfaces wet. It does leave for higher potential of other people accidentally coming into contact with the disinfectant. We hear stories about door handles being disinfected and left wet to dry, air dry, and then others coming along and using those door handles not knowing why they're wet. Especially in a workplace environment where the workers are dealing with these disinfectants day in and day out. The purpose is for these surfaces to stay wet, and so they have greater potential to be coming into contact with these wet surfaces throughout the day. Okay, so a couple less common topics. One of them is to talk about electrostatic sprayers, also misters and foggers. So these are apparatuses that are going to distribute very, very fine particles of the disinfectant over surfaces. And depending on how they work, they might be designed to help the disinfectant charge and stay onto a surface better, or just create a more even coat. These application methods, unless they're specifically on the label, they're not necessarily evaluated by EPA as safe or effective, but they're not necessarily disallowed. They may not be recommended by EPA unless the label says that specifically. However, there is a lot of popularity around the ease in which you can apply these products into large spaces. So you can imagine, although it's not specifically prohibited by some labels, if an individual or worker were to have a product, a disinfectant liquid that they're then using into these large distribution apparatuses like a mister, that potential exposure for inhalation, skin exposure, eye exposure, all of those things goes up a lot. And so we have larger exposure scenarios possible from these foggers, misters, and electrostatic sprayers, depending on a lot of times the field in which the person may be working. This can occur in schools, this can occur in airports or airplanes, as well as medical facilities. And so this is something just to be on the lookout for large exposure scenarios. Another is actually UV light. So UV light itself is not considered a disinfectant. It is not registered as a disinfectant. It's not a substance. And it's not going to have anything to do with the list N that we talked about. So these UV light machines, there could be other things that kill viruses that are not a substance. UV light, it could be the production of ozone, there could be air purifiers. These are typically referred to as pesticide devices because they are some sort of apparatus or contrivance that are meant to kill and destroy viruses or other germs. And so these specific examples are not going to be evaluated by EPA for their safety or efficacy before their use. And so they have something that it's not the same process that a disinfectant is going to go through, and there might be a lot of unknowns as to the actual risks of these products. Okay, and with that, I will let Diana take over.
Great, can you hear me okay?
Yep.
Thanks, Amy. Great information. My name is Diana Sims, and I am the Pesticide Medical Education Director for PERC Med, as introduced previously. And what I wanted to talk to you about today is applying some of the great knowledge that Amy just shared with us and how we can make ourselves useful and be a resource to you as clinicians practicing out in the real world, in addition to the services that NPEC provides that Amy had described earlier. Next slide, please. There we go. So our mission at PERC Med is to help healthcare providers such as yourselves prevent, recognize, and treat pesticide-related health conditions through education, resources, and technical assistance. I'll give you some examples of those as we go through. So one thing, as all of you are probably keenly aware, is that typically pesticide is not routinely included, or exposures to pesticides or how those manifest in patient scenarios. That's not something that's routinely included in healthcare provider training or education. So there's a knowledge gap. Some of the other challenges with talking about this subject matter are that the symptoms are often nonspecific and can be attributed quite easily to other diagnoses. And then providers also are not trained necessarily to recognize these specific types of exposures or to think in their differential diagnosis about what may be underlying some of these symptoms that are walking into the office. And I'll give you some examples of occupational exposure groups. So what you see on the screen in front of you now is a map that PERCmed developed, looking at what are the reporting requirements for healthcare providers. About 64% of states, which you see in the dark green on this map here, do have mandatory pesticide reporting requirements for healthcare providers, sometimes for labs and for hospitals or other healthcare facilities. And so the map that you see in front of you is an interactive clickable map, and we're just going to take where Amy and I are based in Oregon as an example. If you were to click on the state, beautiful state of Oregon, go to the next slide, please. A provider could see that Oregon is indeed a mandatory reporting state, and exposures need to be reported within 24 hours. And then there's a link to where those reporting agencies are on the far right-hand tab. So again, about 64% of states. I'm feeling that most of you are probably in the Oregon, Washington, Pacific Northwest area. And so it's good to be aware of what these reporting requirements are. Next slide, please. So how can we be of service to all of you? So some of the things that PERCmed does is we provide free continuing medical education opportunities, CME, like what we're doing here today. I'll show you some examples of online, more in-depth courses that we offer and support as well. So we facilitate free CME opportunities. And as Amy was describing earlier, NPIC answers the phone when you call. So there's a hotline that's operated Monday through Friday that Amy directs with all of the science communicators at NPIC. And then you can also reach out to us specifically at PERCmed, and we return your email or call as well. We provide subject matter expertise and support and the resources that you may need when you're caring for patients with potential pesticide exposure, including those kind of unusual scenarios that sometimes do come into the NPIC hotline from providers describing these bizarre scenarios. Another thing that PERCmed does is that we network with local and national experts to support you with these challenging encounters. So we partner with, for example, the American Academy of Family Physicians, American Academy of Physician Assistants, different types of national organizations where providers might be going to get those just-in-time resources. We have a partnership that's under development too with different nursing organizations to amplify the message and the educational pieces. Next slide, please. So what I wanted to turn to now is just kind of the nuts and bolts, some of the practical resources that you can find on our website, which includes some of the information that Amy had shared earlier that have these infographic style handouts that are really amenable to using as patient education resources. So the example that you see in front of you is one of the partnerships we developed was with APHN, the Association for Public Health Nurses. And we were really thrilled to be able to incorporate information about pesticide exposures into their new to public health nurse residency training program and get that on the radar of those who are going to be new in the field working and primarily doing home visiting and doing frontline public health work as well. So that's one of the examples of our partnerships. Next slide, please, Amy. One thing that we did early on is to, in fact, what you see in front of you is a brief newsletter article that we worked with the Northwest Primary Care Association to make that link between what in the world do pesticides, most people think immediately about an aerial applicator flying over a big crop and dropping herbicides. And so what we wanted to do is make kind of the big aha moment is, what do pesticides have to do with this thing that we were calling SARS-CoV-2, what we all now commonly know as COVID-19. So what do pesticides have to do with this? And many people were surprised to learn that the infection control products that are used so incredibly widely in hospital settings, in healthcare settings, in classrooms, that those are actually pesticides, as Amy just educated us about. So this is just an example of working with a primary care and community clinic system to get this information out to providers. Next slide, please. This is an example of a partnership with the California Office of Environmental Health Hazard Assessment, and we developed an online free CME course that can be taken by practitioners both in California or anywhere across the country, and provides basic information and more in-depth toxicology information as well for those who really are interested and want to get into the toxicology piece and the chemicals that are active ingredients in pesticides. So this is an example of one of the partnerships where we facilitate free CME. Next slide, please. Some additional resources Amy had mentioned, and I'll have my colleague Rebecca, who's with us here today, post this in the chat, please. In the upper right-hand corner, what you see is basically the pesticide Bible for providers. It's called the Recognition and Management of Pesticide Poisonings in the upper right-hand corner, and that is it's linked on our PerkMed website as well as on Amy's NPIC website, where it's got very specific treatment and symptomatology charts where you can look up what's going on and what are the side effects and look at the latest information about that. So that is an important clinical resource that I would make you aware of today to access that. And also, if there's any interest, sometimes people do like to have hard copies of it. So if there's an interest from anyone on the webinar today, you can feel free to reach out to me and I can get a hard copy of that book sent to you, that manual. So in addition to the RMPP is what we call it for short. In addition to that important resource, and we also have different case studies that are included on our website, looking at everything from lindane, which is a lice treatment that can be used, and it was an overexposure case scenario, looking at aerial application or oversprays, different things like that, that really presented in real life cases and are incredibly useful in terms of a teaching tool. So we're continuing to make those available for resources on our PerkMed website. And then we also are really pushing and excited about new collaboration opportunities that we call our Champion Network, and I'll go into that in just a second. But we provide technical assistance through our advisory board and through our PerkMed team as well. Next slide, please. This is an example of a collaboration with the Northwest PASHU, or the Pediatric Environmental Health Specialty Unit, and it's part of an infographic that was developed and led by Dr. Catherine Carr at the University of Washington and her colleagues there. And what we did is these are for pediatric specific signs and symptoms for pesticide toxicity. We have one that's about acute and chronic exposures that's on our website. So using an infographic style approach to looking at what are some of the signs and symptoms that providers should be aware of, their skin irritation, the eyes, cardiac symptoms, dizziness, neurology, and respiratory issues. As Amy was mentioning earlier, some of these products that are so incredibly widely used in the disinfectant category do tend to potentially produce asthmatic symptoms. And so there's been an increase in the use of these types of products and symptoms that are coming into different healthcare facilities. So this infographic just is a quick snapshot of what you might be looking for as a provider of something that's coming into your office or clinic or other type of setting. Next slide, please. And again, this is just to reinforce most comprehensive source that provides consensus recommendations on how to recognize and treat pesticide poisonings is this book, the RMPP. Next slide, please. So what I wanted to spend a little bit of time talking about today is what are some of the future directions that PERCmed is headed. So I had mentioned about our work with national healthcare provider organizations, such as the American Academy of Family Physicians, National Nurse-Led Care Consortium, and other places. You can probably hear my dogs growling in the background. Sorry about that. So we have a great interest in working with regional provider organizations as well. So since people on this webinar are coming from the Oregon Pacific area, we'd be interested in providing through our Champion program additional educational and outreach opportunities within your regional networks here in the Pacific Northwest. So if anybody's interested in having a presentation done by a clinician, for example, feel free to reach out to me, and I would be happy to connect our resources to you to do more specific training and awareness in this area. So I think Rebecca is going to post that as well. I don't have the presenter control right now, but if you look on our PERCmed website, you can find a link to our help us schedule a speaker type of thing for this Champion program. If you're interested as well in specific topic areas, one of that might be more broad than looking beyond just disinfectants, but looking at insecticides and other types of things that your patient population may be encountering, I encourage you to contact me. And we often think about, the vast majority of pesticide usage occurs in the agricultural industry, about 90%. But what ends up happening is that so many other occupational groups are often overlooked. So as we're focused here today, specifically on disinfectants, some of the occupational groups that would be at increased risk of pesticide overexposure include those working in the hospitality industry, those working in restaurants, so the people who are cleaning office buildings at night after the building is empty, people who are working in hotels and exposed constantly, and who might not have access to the appropriate PPE that needs to be worn when applying these disinfectants, or who might not have the resources that they need, or there could be language barriers or educational barriers in terms of providing access to the right types of information or the right types of PPE, or even access to hand washing, for example. So some of the other occupational groups that could be at risk, we always want to encourage people to think that in addition to those populations that are working in the agriculture industry, that also at risk can be those working in forestry, in fishing, in construction trades, and in healthcare. As one of the slides that I love that Amy showed earlier was with the what looked like a patient care room and the disinfectant being aerosolized into the room, and thinking about how long a room like that would need to be empty and who's going in to clean it, and then just the different real life scenarios that could happen. And so one of the things that we like to always try to do is think about how do these big concepts and big ideas really translate into what you as a provider are seeing in front of you, what's coming into your urgent care clinic, what's coming into your primary care facility, what's coming right in front of you, and help think about ways to integrate screening for these types of exposures when you're looking at different occupational classes. If you have a family where mom or dad are working in the fields, and maybe the oldest multi-generational family living in one house, and you have other family members who might be contributing to take-home exposures. So if there are pesticides that are clinging to, residues clinging to a person's clothes or to their shoes, and then they are coming into the household, and there are small children who are crawling and using the typical hand-to-mouth behavior of a young child, and now the clothing, and the boots have just been worn and over the surfaces where there have been potential residues of pesticide clinging to those different work pieces of clothing. I think next slide, please, Amy. This should be the last one. I want to be aware of time since we have about 10 minutes and see if there's any questions. If you have any needs or interest in collaborating with PerkMed or interest in having a clinician-to-clinician webinar, I'd encourage you to reach out to me here on my email, drsimmes, S-I-M-M-E-S, at UC Davis. And I'm hoping that you can all see I can't see the chat box as I'm presenting, but that Rebecca's populating some of the resources I've been talking about here. And I think we're at the very last, the next slide, Amy. There's one more.
I think that's it.
I'll let you talk about that one, about the hours more specifically.
Yeah, I just wanted to reiterate what Dinah was saying about, you know, we're here for you if you have questions. So I think that when a provider is encountering a situation with pesticides, you know, you're not necessarily going to know exactly where to go to. But if you can remember that there are resources out there like PerkMed and NPIC to help you find the appropriate treatment information, or other resources that are available for education and things like that, then I hope that that will be a useful tool in your toolbox. And so we have time for questions if there are any.
All right, thank you so much, Diana and Amy. To our audience, if you do have any questions, again, there is a questions tab on the menu bar, and you will be able to type any questions that you have in there, and we can address those. I do have one of our attendees that said, thank you so much for a great presentation of a very important information. That was John Gravatt. So far, there isn't any questions coming through, so we'll move on. Again, I'm just going to go over a couple more housekeeping. So first of all, we want to thank you for participating today. Second, we do need your help. We need you to take a moment to complete this post-webinar survey that will actually be appearing at the eads.com website, where you're going to enter the activity code to receive your certification. We will email you, or if you would like us to email you the slide deck, if you had trouble downloading it, again, that was in the handouts portion of the menu. We'd be more than happy to get the slide decks to you. The webinar recording will be available within a week on our website. Again, it's www.opahec.org/webinars-1. You can also feel free to reach out to me or our office if you do have any questions or concerns regarding printing your certificate, or if there's any issues from the eads.com website. We'll be happy to be of assistance. Again, finally, to obtain CME or CE for this activity, you must log in with 7 days to get your certificate from eeds.com and enter the activity code. And again, I will put the activity code up here for everyone. It is 91CAST, and that will allow you to print what you need to get that over for your CME or CE. If you have any further questions, I don't see any other questions, Amy or Diana, that have come through. Just the thank you so much for a great presentation. And all right, please remember to answer the post-webinar survey from eads.com and print your certificates again. Thanks to our speakers for sharing their time and knowledge with us. And thank you all for participating. You've completed the webinar, and at this time you may disconnect.